welcome to The Explainer. Today we're talking about a condition with a name that sounds like something right out of a sci-fi movie, but it's a very real neurological challenge. It's called Organic Amnestic Syndrome. Just think about that for a second. What if you could live through an entire day, have amazing conversations, meet new people, but then poof, it's just gone? Not tomorrow, but maybe in a few minutes, as if it never even happened. That's the reality we're diving into today.
All right, so first things first, we need to be super clear about what this isn't. This is not dementia in the way most of us think about it. You see, dementia is usually this widespread decline that affects all sorts of cognitive functions. But organic amnestic syndrome? It's way more specific. It's like a laser-guided missile that hits your memory, and only your memory, leaving things like reasoning and language totally untouched.
So what does it really mean for a memory to just be erased like that? Let's get right to the heart of what this syndrome actually is.
The clinical definition really tells the whole story. It's a memory problem, first and foremost, and it's caused by organic, meaning physical, damage to the brain. But here's the kicker. It happens without those other major cognitive issues. Basically, the part of your brain that saves memories is broken, but the rest of the machine, it's still up and running just fine.
You know, probably the best way to wrap your head around it is to think of your brain as a computer. All your old files, your childhood, who you are, skills you learned years ago, that's all your old software. It's still there, you can access it, but the save button, it's busted. Any new experience, any new piece of information, it might flicker in your mind for a moment, and then it's just gone. It never gets saved to the hard drive.
Okay, so this kind of really specific damage doesn't just happen out of nowhere. We need to play detective for a minute. What are the things that can actually cause this?
Well, the list of potential causes is pretty wide-ranging. It can be something sudden and violent, like a head injury or a stroke, or it can be something that happens more slowly over time, like chronic alcoholism or not getting the right nutrients. But they all have one thing in common. They can damage those very specific, very delicate parts of the brain that are in charge of making memories. Let's zoom in on a couple of the big ones. So, a physical injury, like from a car accident, or a stroke that chokes off blood flow, that can directly damage the brain's memory headquarters, places like the hippocampus. The damage is fast, and the effect on memory can be immediate and, frankly, devastating. Now, here's a really well-known one. Chronic alcoholism can lead to a really severe deficiency in thiamine, which is a B vitamin. And that deficiency can cause a specific condition called Korsakoff psychosis. It's actually a textbook example of this syndrome, where the main and most dramatic symptom is this profound loss of recent memory.
Our brains are incredibly hungry for oxygen. I mean, they just devour the stuff. So if the brain is deprived of oxygen, even for a short time, we're talking about something like a cardiac arrest or a near-drowning incident, it can cause permanent damage. And the brain cells responsible for memory are some of the most sensitive to this.
So we know what it is and what causes it, but what does it actually feel like? What's it like to live inside a memory that's always hitting the reset button?
There's a clinical name for this experience: anterograde amnesia. Antero just means forward, so it's a forward-acting amnesia. All your old memories, everything that happened before the brain injury, that can be perfectly fine, but trying to form new memories after the event, that's what becomes almost impossible. It means every day can literally feel like the same day. You might meet the same person for the first time again and again.
And this leads us to one of the most fascinating and often misunderstood symptoms. It's called confabulation. See, when the brain is faced with a total blank spot in memory, it hates it, a vacuum. So what does it do? It unconsciously invents a story, a plausible but totally false memory, just to fill in that gap. So you could ask someone, hey, what did you do yesterday? And they might tell you this vivid, detailed story about a trip to Paris, even though they haven't left their hospital room.
And this part is absolutely critical to understand. This is not lying. The person isn't trying to trick you. It's a symptom. It's a neurological reflex, like a knee-jerk reaction. It's just the brain automatically trying to make sense of the world when the data it needs is missing.
So, given how incredibly challenging this all is, you have to wonder, is there a path forward? And the answer is yes, absolutely. But the goal isn't really to cure the memory loss. It's about building a stable, supportive world around it. The whole approach to care really follows a clear, logical blueprint. It all starts with a number one priority: safety. I mean, if you can't reliably remember your environment, preventing accidents is job one. Then, once that's covered, you move on to supporting their memory using external tools. From there, the goal is to help them be as independent as possible, all while wrapping it in the emotional support they need to navigate this new reality.
And here you can see how that blueprint gets put into action. It's a really clear path. You see a problem, like disorientation. That leads to what's called a nursing diagnosis. Here, it's a risk for injury, and that diagnosis points you right to an intervention, creating a consistent, structured daily routine. It's just a logical flow from problem to solution.
For any family members or caregivers out there, these strategies are they're lifesavers. The absolute biggest thing is predictability. A stable environment, packed with memory aids like big calendars, whiteboards, and sticky notes, it essentially becomes an external hard drive for the brain. Simple things like gently reminding someone of the day and time, keeping things quiet, and just offering constant reassurance, that becomes the bedrock of good, compassionate care.
And that really brings us to a final, pretty deep thought. We all think of our memories as the bricks that build the story of who we are. This condition shows us that when that internal storyteller gets interrupted, things on the outside, like care, structure, compassion, they can become the scaffolding that helps preserve a person's story and their dignity. It leaves us with a really important question, doesn't it? How do we help someone write the next page of their story together?